It's important to us that we deliver that news when, where, and how our readers expect to engage with it, which is why Post, as well as identifying key content areas that are important to them. The GrowthOp is a prime example of this investment. With the recent passing of Bill C-45, it's more and more important for Canadians to understand how cannabis relates to them and how legalization will affect them, which is why we are focused on bringing them all the news and views around cannabis. Post Media has been covering cannabis for several years now, in the Financial Post and National Post, as well as some of our larger urban brands. In fact, the Financial Post has had a dedicated reporter on cannabis for over a year, Mark Randall, as some of you have probably read his stuff. But even with all this coverage, we knew there was still going to be a gap for the audience, specifically around education for the recreational market. So along with all of the business, news, and health coverage on the GrowthOp, you will find content focused on how the new, old, and returning cannabis users can engage with cannabis in a responsible and intelligent way. We want to drive the conversation and help to normalize cannabis for Canadians. It's exciting to see our country take this historic step forward. And as we move forward to implementation of the Cannabis Act and eventually product in stores October 17th, we hope to continue to see the innovation and research that has expanded over the last few years within the sector. With these new techniques, technology, and processes, we are benefiting not only the cannabis industry, but many business industries. This leads us to today's topic, understanding the global cannabis economy. As the first G7 country to legalize cannabis, Canada is leading the way when it comes to creating a global partnership in the industry. Today features a variety of industry players from licensed producers, cannabis compliance, and legal minds focused on the space. Let's introduce our panel. Deepak Anand is the Vice President of Business Development and Government Relations for Cannabis Compliance and a recognized thought leader in the cannabis space. Bringing 15 years of leadership experience in health, charitable, nonprofit, and private sectors to his role, within the cannabis sector, the global cannabis sector, Deepak has worked with senior government officials, politicians, policymakers, health professional organizations, clinical practitioners, educators, investors, and patients, as well as licensed producers. Navdeep Dhaliwal is the president and director of the Supreme Cannabis Company, Inc. He previously served as the company's chief financial officer and has extensive background in capital markets. Ranjeev Dhillon is a partner and the co-head of the cannabis business unit at Bennett Jones and is one of the top business lawyers within the Canadian cannabis business sector. He's been working extensively in the industry since 2014, and his cannabis clients include Canadian and international companies, licensed producer applicants, marketing and branding firms, just to name a few. Julian Fantino is the executive chairman of Aleafia. Julian's distinguished career in law enforcement and government as the Toronto, York, and London police chiefs and Ontario's Commissioner of Emergency Management culminated in his appointment to the Ontario Provincial Police Commissioner. He was then elected to Parliament, becoming the Minister of Veteran Affairs, National Defence, and International Cooperation. He's a leading expert on drug enforcement and federal regulatory policy. Julian advocates for the well-being of first responders, police, fire, and military personnel with post-traumatic stress disorders. And last but not least, Jordan Sinclair. He's the Vice President of Communications and Media for Canopy Growth Corporation, the world's leading cannabis company. He joined Cannabis Growth in 2014 and has since been responsible for developing and articulating the company's vision through a period of unparalleled growth. Jordan is a regular fixture in Canadian and international media on the sector and is a deep believer that cannabis can be a force for good. Again, I want to thank you for joining us today. I hope you enjoy the panel. And without further ado, I'm going to hand things off to Larysa Harapyn from Financial Post. Thank you.
Thank you, Megan. Good morning, everyone. Good morning to our panel. I know you guys are happy to be here. I just talked to you a few minutes ago. Okay, let's get this out of the way right off the bat. Joint venture. Let's weed out the smaller companies. What else? You guys have heard these before.
Smoking busy.
Smoking busy, okay.
Something blunt related would probably be appropriate. Can't remember which one.
Deepak, you
Let's
got
get
a good
into
one?
the weeds.
Let's get into the weeds. Okay. We can't promise we're not going to use these over the next hour, but nevertheless. Bill C-45, as Megan mentioned, becomes legal October 17th. From a regulation standpoint, has our government gotten it right? Deepak, you've worked on regulations in the past with Cannabis Compliance. Help us understand.
Absolutely. I mean, the federal government's done a lot of work on this file, right from the initial days of the MMPR, which was the version of the regulations before the existing iteration of the ACMPR. The federal task force done a fantastic job around creating a report that has looked at and consulted with stakeholders across the country. So in my opinion, they've gotten a number of things right. One of the things that I would have liked to see in the first iteration of legalization has been the inclusion of edibles and vapes and concentrates. We're not seeing that yet, but we hope to see that.
It's coming.
Absolutely.
What have you seen in terms of Canada on this global arena? How do we fare in terms of the legislation and legalization?
Well, ours is much more developed. I mean, we've got a few years ahead. I think what we did really well was we started with production. So the regulations as they existed in a number of the states in the U.S., they seem to focus more on the retail side of things. How is this going to interface with the consumer? I think what's more important for a regulated industry is what's happening that the consumer never sees. How robust is it so that the product is flowing and you can really trust the supply chain as it grows. They had a lot of reputational issues in Denver, for example, and throughout Colorado because the product wasn't either up to snuff or it didn't have the content that was advertised within it, and that really shakes consumer confidence. So I think on the Canadian side of things, we've done really well by focusing on production first. And now, because in the recreational market, retail has been basically punted or handed over to the provinces, we're going to get to see a bunch of models compete against each other. So we'll get to see if state-run is better than privately run from a social perspective, from a health perspective. So that'll be great for sort of data capture and for us in business, hopefully a good business case to be able to convince people to let us sell it ourselves.
Now, we have seen what some of those retail models look like, aka New Brunswick. What do you think of that model, Nav?
I think there's merits to all of them. I think what's quite different than other markets is we're dealing with quite sophisticated retailers from one aspect in terms of the provinces, and then you're allowing private in as well, or hybrid models. I think they all have merits. One will, I think, a more private model might lend itself well to providing a lot of education because it's a private enterprise, so you're more dependent on the proprietor to educate the consumer. I think it's going to be more consumer focused, whereas I think provincial models are going to be more, more bureaucracy. It's more of a monopoly type of market. So I think there's benefits to either. I think the hybrid models will give great insight as well in terms of how they differ from one another. So I think we'll see. But I think what's different in Canada than say U.S. markets is the U.S. markets, as Jordan was saying, is far more of a wild west. It's much easier to get into the business from a production standpoint, from a retail standpoint. And I think that caters towards innovation, marketing, etc. But I think, going back to what the government's done right, I think our government's started from production to ensure supply chain. It's a very sophisticated, very commercial type of market.
Ranj, from Bennett Jones' perspective, some of the things that you saw a year ago compared to now?
Yeah, so still very hot. It's busier than ever. I think what we're seeing more professionalization, I call it, of the industry, and I think that's a trend that will continue. I think a year ago or 18 months ago, you saw a lot of people that were in the system for a while, but you didn't see a lot of people that were, like, say, in pharma or alcohol or less so, and you're seeing more and more of that. I was in Calgary, and I spoke with a number of CEOs and directors, and many of them were sort of at the point where they're going to retire, and they were looking how to get into the industry. So I think that's a trend that you're seeing, and I think we'll continue to see consolidation, and I think that's a trend that we'll see for different reasons. The deals are getting larger as well, right, which is a little bit different than last year.
Julian, has the government paid enough attention to medical cannabis? And having said that, should we or have we been looking at other countries around the world with respect to medical cannabis?
Well, the preoccupation now has been for quite a long time to the recreational side of new legislation and processes and so forth. But I think once that's out of the way, there'll be a flurry of activity, more so in the medical side, knowing full well that there needs to be rigor, more science, more proof of the value and worth of the medicine, especially in areas where people can be weeded off of opiates, as we see the response now to such things as chronic pain and other ailments. So I think the medical side will grow exponentially, and we see more and more people, professional people, doctors and so forth, embracing the value and worth of the medicine in helping their patients through difficult health issues that are not being well affected by traditional medicine. So it's going to grow. I believe that this is going to be the future once this rec thing is out of the way.
Deepak, you're nodding your head. Jump in.
Absolutely, yeah. So we've done a lot of work on the medical side for the past 5 years, working with a number of pharmaceutical companies and pharmacy chains in the space that are working very hard with Health Canada to sort of lobby and change some of the regulations to allow access through the pharmacy point. Licensed producers are doing some amazing work in terms of clinical trials around some of the pain management, some chronic pain areas, arthritis. So we're really leading the world in that sense. You asked if the world is sort of, we're following the world is actually following us in many ways. We're doing a lot of that R&D work, so I think it's fantastic from a medical side.
Nav, question for you from your perspective in terms of Supreme. How do you differentiate yourself from a company like Canopy? Are you going to focus specifically on niche? Do you have plans to globalize? What does that look like on the horizon for Supreme?
Yeah, I would say we're part of a second or third wave, as you would call it. Canopy is definitely a market leader, a global market leader. So when we came to market, our view was, we're seeing the first signs of early stage market maturing. If you look at general market theory, market segment as they mature is way down the line where you see full consolidation. So what we decided to do is, taking a very long-term view as any business, we wanted to focus on, let's build an advantage in one area or build proprietary value expertise in one area. And where we saw our strengths, that was around cultivation of quality at scale. So, I would say, and we look at it from an infrastructure basis. So we looked at it, that infrastructure will produce a high quality product. In our view, the recreational market is a quality driven market. Consumers demand quality, especially the ones that are high usage consumers, or as we call them, cannabis enthusiasts. We view they'll move to quality over time. So we just decided to focus on one aspect because I think given the time we were coming to market, trying to be the same as everybody else or trying to be, a big guy, as the market gets more and more saturated, it's difficult. It's more and more difficult to attract capital. So you have to have some sort of compelling aspect or something that is different or an area where you're developing some sort of advantage. So we decided to just kind of take our own road versus trying to be
the next Canopy.
Yeah, because I think that's, my view, that would be somewhat foolish and unrealistic because, you got to look, Canopy's much further ahead than other companies are. They're a much larger enterprise, et cetera. So you have to focus on where you think you have an advantage. So that's what we decided to do. So, we're quite happy with where we're at now. But I think it was just more of a strategy of focus where we think our strengths were versus trying to look at the market and try to mimic or be like someone else.
And Jordan, from your perspective, from Canopy Growth, when you take a look at that map, Canopy has been pushing into Europe, has been pushing into South America. Are there opportunities to push into Africa or Asia? Is that something the company's considering?
Of course, yeah. So I mean, we've pushed into Africa. We've acquired an entity that operates in Lesotho, so that's a little landlocked country that's in the southern part of the continent. That market, if you look at it, is more about South Africa than it is about Lesotho itself. But of course, like every part of the world is enticing for different reasons. Some of them tend to be much more difficult to enter. So if you look at the European continent or South America, they're 1 or 2 years behind Canada. Australia probably 2, but accelerating very quickly. And in Asia, they're playing their cards really close to their chest. So there is some interest, I would say, in the Asian continent. A lot of people live there. Obviously, a strong tradition of using herbal medicine. But from our perspective now, the focus really is on Europe and on South America.
And Julian, from your perspective, you're focusing on medical cannabis. I mean, does the company have any plans to go global?
Well, our most immediate priority, of course, is to go from seed to sale and look after our patients and the network of clinics that we have across the land. So that's our main focus right now. But we're looking at partnering up on research and development, especially with Israel. Some of the leading work in this particular sector, medical sector, has been done by the Israelis. So we're looking at those kinds of partnerships, and we hope that that side of this whole industry, if you will elevate the science and the research that needs to be done in order to hopefully one day, as I mentioned earlier, make this a traditional available medicine for people who are in fact, and we know anecdotally, if you will, can be helped. So there's a lot of work being done, but I think Canada is probably, along with probably the Israelis in that, leading the effort in that whole research and development area that hopefully one day will make the medicine here in Canada part of the drug identification criteria approvals from Health Canada.
Yeah, and the interesting thing about that is the profit motive that industry brings to that is going to put it into hyperdrive. So the black market hasn't done a lot of work on clinical trials. They haven't done a lot of work on product innovation over the last number of years. But you're going to see that advance at a much more rapid pace now that we can have clinical trials that are really expensive to run. In Canada, there hasn't been any government interest in supporting clinical trials. In Israel, there's about 100. Many are supported by the government. Even in Australia now, there's a handful that are receiving direct support from the government. So I think in Canada, it's industry that's got to step in. And I think it's less, like Deepak was saying, about lobbying pharmacists and lobbying to change laws. When you've got the drug that meets all the criteria for the normal approval processes, you don't have to lobby anybody. You just put it through the normal approval steps. So cannabis in Canada is this really strange category of one, where we've got these laws that, they only apply to this one thing, but there's medical benefit for it. Maybe it could be run through the natural health product system. Maybe it should be run through like the more pharmaceutical process system. But we tend to talk about cannabis as its own thing. I think we'll do a lot of good for the industry and patients if we start really talking about it in the context of other medicines, of it being included in curriculum in medical colleges, if it's being distributed through pharmacies, like normal medicine, because that's really what it is.
Deepak.
So just a couple of models that we're seeing is in Canada, there's a handful of companies that are exporting medical cannabis. And the reason for that is because something called GMP, only a few, probably 6 or 7 licensed producers actually have GMP. That's what you need. It's called good manufacturing practices. That's something you need to be able to export medical cannabis out from Canada into the European markets. And so what we're seeing is where we've seen companies like Supreme that are now looking at deals internationally, you're seeing companies like Aurora and Canopy that are already exporting cannabis, and that's because they have GMP. So we're seeing a lot of our clients that have both licensed producers and applicants looking fundamentally to getting GMP so that they'll be able to export. That's been one of the challenges in the space. But as we evolve, we're starting to see a lot of people go towards this GMP process that really raises the standards for the industry.
Yeah, and I think just to pick up on a couple of things that have been said, and I think Jordan and Deepak have made some good points on this recently. I think we're going to see more and more scientists move into this, and we're seeing that already, right? Like people chase where the money is and where the government grants are. So we're, as a firm, we're seeing more and more scientists moving over from doing research in other areas into cannabis now, because they want to do research, they want to do good, and I think they see cannabis as a way to do that. And I see we're seeing Canada partnering up with places like Israel to do more and more research. There was a deal announced yesterday, right, with a joint, an acquisition of an Israeli firm on the research side, which will be interesting. I think Deepak made a great point on the GMP side. And I think one thing we have to realize, it takes a long time from being an applicant to being able to like sell and export. And a lot of the people that have sales licenses were the people that applied early on in the process. And good for them, they took the risk on, and great. But I think the standards have changed a little bit. You're seeing people get more, the standards of like the facilities, at least from what I've seen when I visit sites, it gets better and better and better over time, as it probably should. Things evolve over time. And I think in the next couple of years, we'll see more facilities are going to be at that high GMP standard. That's my personal belief. We'll see if it bears out.
Well, barriers to entry now are way higher than they were. So I mean, people would talk a lot in 2014 about this being a model that favored big business. That's more true today than it was. There are a few microprocessing licenses types that are going to be included in C45, but on the ACMPR side, with all of those improvements, it has created a big moat just based on capital.
I like to bring things down to a practical level where, for instance, looking at a study that we're doing at Aleafia right now with 1,000 patients who are basically prescribed opiates as we speak, Oxycontin, Percocet, fentanyl, whatever, for their issues, and weaning them off of that onto medical cannabis. And albeit anecdotal, the results are very, very, very encouraging. So if you look at the tragedy of 4,000 people having died here in Canada last year from opiates overdose, for instance, and how overly prescribed that particular medicine is, and how counter that with how medical cannabis can be such a relief, such a big help in that particular area. So I think the medical side, as I said earlier, is going to be growing exponentially, and people are not out of tune with that particular issue.
And just from a Canadian perspective, I mean, it's very cool to see what we're doing internationally. For those of you who've been following the media recently, we had a child in the UK that has severe epilepsy, and her medicines were taken away from her at the UK border. And in an unprecedented move, we saw the UK border actually go back at the hospital and give this child her medicine back, and she was released from hospital the next day. And that just goes to show benefits of medical cannabis, and what we're doing in Canada is having this significant impact internationally. Countries like the UK and elsewhere that are now starting to have a conversation and say, hey, we should re-look at cannabis and medical cannabis, especially when you look at kids with pediatric epilepsy. Yeah,
and just following up on barriers to entry here in Canada and then international, I think also what's being developed is just real significant intellectual property. So, frankly, there's no real commercial cannabis production infrastructure anywhere in the world. There's some aspects in the US, but Canada's had a federal legal environment, very robust capital markets, and been at it for almost 3 to 5 years. So now taking that intellectual property to, say, a new market, say like in Kingdom of Lesotho, we made an investment there as well. You're saving years in terms of design of infrastructure, construction of infrastructure. So it's that Canadian IP is really showing on the international markets as well, in addition to just regulatory, et cetera. And what we're seeing is, in Canada, you didn't need to be GMP for domestic business, but to be international, you have to be GMP. But what it's also looking like is happening is international companies that want to partake in the international landscape, they're going to have to be GMP right off the bat, right? Because they're going to have to build up their standards, their compliance. And if you're to use a comparable in terms of other industries, if you look at the global pharma API industry, that's very sophisticated. That's all GMP. Those are like the base requirements, right? So I think
it's almost like it's real medicine.
Exactly. Yeah. Right. So you're seeing that change happen very quickly, and that's where I think, going back to the Canadian government, that's something that the government did very well, is make it a federal program, make it very serious, and now that's showing big advantages internationally.
I want to go back, I want to shift the conversation a little bit and go back to something that I heard probably each one of you mention, and that's consolidation. Are we going to see more mergers and acquisitions in the sector, or have they cooled?
Personally, I think we're just getting started on that side. I think we are going to see more consolidation happening. We are going to see companies that are buying others. I mean, Aurora is a classic example. They've been on a buying spree recently. I think this is just the beginning. We'll see more of it.
Difficult to predict, but I would probably bet on yes. Primarily because I think the big acquisitions you'll probably see less of, primarily because there's just fewer to be done. I would say some of the bigger companies are probably happy where they're at, not looking to pay the prices, because it's the market caps of these companies aren't cheap. Where I think you're going to start seeing it more is in the early to mid tier driven by a few reasons. I think one is the industry domestically and internationally is getting competitive very quick, so you're going to start seeing consolidation of talent. So I think talent teams that are focused on a certain aspect of the business, that's going to be attractive to acquire and bring into a company. Two is you're going to start seeing technologies that make your business better, that give you a better competitive advantage. I think three, we'll start seeing a little bit more over the next year or so, is when you start seeing really innovative products. So products from a medical aspect, kind of going the way of, say, like branded generics, et cetera, or touching more of the pharma aspect. But even on a recreational side, if you start seeing, because the thing is, right now, in Canada, you're only selling to the medical market, and I think that market is not a true representation of the consumer market. I think that's going to be a significant learning experience, how consumer trends, right now, frankly, a lot of companies are probably just guessing. So you don't know what the consumer is actually going to prefer, what they're going to buy, are they going to buy your product, and for a while you're dealing with supply and demand. But point being, I think once you start seeing those trends, what people are actually wanting to purchase, you're going to start seeing acquisition based on products, product quality, brands. Right now, brands are surface level, I would say. There's not much texture to it. Typically when you look at a brand, you want to see, okay, what's the revenue behind it? What's the pricing power of that brand? That's truly how you really value a brand in a mature market. So I said, talent, tech, and then brands and products when you start seeing some maturity in the market.
Ranjeev.
Yeah, I think it's inevitable we'll see consolidation for a number of reasons. One is the deals are relatively cheap to do because they're done on paper, right? They're mainly stock deals, and you don't have to reach into your own pocket to do a lot of these deals, which makes the deals easier to happen. I'm still surprised by how much paper is traded on these deals, but that seems to be the trend, and that seems to be the norm in the business. I think another reason, and Jordan's going to make a point later because we talked about this before, and I think I'm going to leave him to the M&A portion of why the M and the A are different. But I think the other thing that we're going to see is just execution. There's going to be a lot of people that just fail, right? It's not easy to grow large amounts of cannabis. And it was a point that Nav and Jordan were talking, well, it was Nav talking about, are we going to go towards Canopy and we're going to do our own thing? Two people can have the exact same idea, and one will execute and one won't. And the one that doesn't execute will be there to be had on the cheap. And I think we'll see a lot of that where people, unfortunately, will fail. I do agree. I think some of the large transactions, the mega transactions won't happen. But I think there are still some transactions in the $100 to $300 million sort of range that'll happen. Then we'll see a lot at the very bottom level, people being picked up on the cheap. And I think the other trend we'll see is acquisitions of ancillary companies, non-cultivation companies being purchased, right? So we're seeing some of that with companies like Aurora and Oxley, formerly Cannabis Weed, where they're picking up companies that aren't cultivating, but they're ancillary to the cultivation somehow. And I think that's a trend that we'll sort of continue to see.
Jordan, Julian, weigh in.
Well, the consolidation will certainly come. This is not a unique industry, if you will. It's just another business. So I think we can apply the same kind of experiences we've seen in other sectors where there will be consolidation. And there's other related industry or related interests that will play into this very heavily. Whether you look at the big pharma, whether you look at all of the sundry and involved support systems that are obviously focusing on the cannabis space. All of this will drive people to consolidate, to become more aggressive in their opportunity, if you will, to access some of that growth in this particular area of business. So it's inevitable. It's a business kind of scenario that will in fact lend itself to acquisitions, and we've seen it already, and it'll continue. I think the trick for some people, certainly it is for how we see it at Aleafia, is to carve out our own niche from seed to sale to patient and looking after our patients. That's our primary focus, and I think for us, we don't want to compete with the big growers or the big players in all of this. We want to carve out our own niche, and we want to be patient focused, look after our patients, and that will mean a whole lot of things that we will do and continue to do in a good way to, in the end, be successful.
Jordan, big reckoning coming?
Yeah, so, well, I guess the way that everyone's looking at acquisitions in this space is LP1 buys LP2, and they are now, some larger LP. Capacity-based acquisitions, I would say, are probably going to stall for a little bit just because of where we're at in the game. I think that you would have had to do that work and do the consolidation and get it up and operational a little while ago in order for it to be a little seamless. There's a lot of things you can acquire. And you can acquire IP to create a device. You can acquire a really hot genetic that the market's loving a lot, and that might include buying an entire little company if they've got something that's really cool. Because you can turn a genetic into a powerhouse, right? Like you can take one really strong product and build something around it. So in the beer game, that's how it goes. If something gets too popular, the big guys pick it off. I think you'll start to see a little bit of that in the cannabis space. But for right now in Canada, I would say like that model of one buys two is over because it's all happened. And on the international side, there will be a lot. Yeah, there'll be a lot of acquisition. Just as you look at that build or buy question, you have to consider what is it worth to buy this right now, or could I build it, and what do I lose if I have to build it myself? And the one thing that you lose if you build it yourself is time. It's the commodity that's the hardest one to compete against. So as we're all racing to go international, I think you'll see a lot of acquisitions.
I think
I want to open it up. Sorry, go ahead.
So I was going to say, Jordan, I think the interesting thing about when you're talking about the international thing, and I actually worked on that Canopy deal, is it's the time factor is obviously very important. It's also, in certain parts of the world, it's really important to have people that are local and on the ground, right? And I think that's a trend that we've seen as well, and I should have touched on it earlier, is that you're seeing a lot more people actually have boots on the ground. Like a year or two ago, deals were joint ventures where the Canadian company would exchange maybe personnel for a little bit, information or IP, but no one was actually going from Canada to put bricks down in a place like Lesotho, and now we're seeing that's actually happening. It'll be interesting to see how that trend continues.
Now, I want to open it up to questions in a minute, and we're going to take questions on social as well, but there was a recent launch of the Global Cannabis Partnership. So I'm wondering how, because you guys all seem to get along, how are LPs working together to lead the way or pave the way globally?
So I probably start with that. So about 5 years ago, I sort of set up an industry association to lobby on behalf of the industry with government. And it wasn't just lobbying, it was also acting as a partnership. And then since then, Cannabis Canada, or what's known as C3 now, is doing a lot of great work in terms of working together, internally as licensed producers, to work with Health Canada as well as physicians and multi-level stakeholders on raising standards for the industry. And Global Cannabis Partnership is intending to do the same thing, is taking that internationally and saying how do we take best practices from Canada and really implement them internationally.
Mm-hmm. Any questions? Go ahead. Hang on, we have a microphone for you.
My question is related to the medical cannabis. In the pharmaceutical industry, really the key profitability comes from the period of exclusivity when the drug is approved. So when we look at the cannabis market, so apart from probably first few who are first in class in every single limited space of the diseases domains where cannabis has shown promise. Beyond that, where does the cannabis industry look to create that particular opportunity?
Yeah, you have to look beyond THC and CBD. Yeah, you have to look at the other molecules. You have to get to a point where you understand the plant and understand which parts of it does what and why, and that's how you can get a little bit further beyond, a sense where you've got generics.
Yeah, just to add to that, I mean, you look at companies like GW Pharma, what they've done with Sativex, is significant. I mean, not only are they a very profitable company, they're, executing on a significant promise to a number of patients that are benefiting significantly. From an opportunity perspective, you look at Charlotte's Web, it's a great product. In fact, in Canada, we're still importing Charlotte's Web type products because we don't have that formula, that concoction, that IP here. So I think there's a lot of opportunities in products like that as well.
Yeah, I think that that wave is going to come. It might just be a little bit later. I think GW getting FDA approval on Epidiolex was a big event. I think what still needs to happen is you still need some maturity globally with regulatory environments, et cetera. So if you look at, typically how pharma drugs are developed, I think unless you're a sizable company and you can absorb the costs it takes, typically to develop a drug with IP protection, it's usually about $1 billion in capital on average. It's a high level number, but that's in an industry where you have foundational knowledge. The exciting thing about cannabis is we really don't have much in terms of globally accepted foundational knowledge and research. So what I think is going to happen is, you'll have pure drug development companies come out because typically that's how they're financed. At the end of the day, drug development is a de-risking exercise. So I think you're going to see an emergence of pure pharma focus, drug development focus, and typically those are small teams, research infrastructure. So I think that's, in our view, that's one misconception about the cannabis business, is that it's one business. Whereas, there's many different businesses here. Your recreational looks like it's going the way of CPG. That's going to be a very complex, sophisticated CPG business. You're going to have your generic type of medical businesses as well. You're going to have your drug development. You're probably going to have, as Jordan was mentioning, very large genetic businesses. Like, for example, if you own the genetic Girl Scout cookies, who knows how much that one's worth? That one's worth billions in terms of, it's one of the most preeminent genetics out there, right? So I think that is going to come. I just think it will happen in a different way. But overall, it's not one business. There's a lot of things going on here, and as you mature, I think things are going to segment.
And I think a lot of times, and Jordan and Nav made the point pretty clearly, that people think of cannabis as just one thing. I think when I think of cannabis users, I don't actually think of what most people think of as like a bunch of frat boys at U of T smoking on a Friday. Like, that's not, I don't think, what the real cannabis companies are thinking about. I think the target is really someone like my mom, who's never actually had a drink of alcohol in her life, but she's getting a little bit older. She's worked in a factory for many years, has a sore shoulder, knees can be a little bit better, and like, that's someone who's looking for some pain relief, right? And someone like that is probably the ideal user because they're going to be loyal, they're going to use on a consistent basis, and price doesn't really matter to them because they need it for comfort, right? And so I think just because the number of people globally, and obviously including Canada, there's just going to be a huge market. So I think we'll see lots of people focusing on that. And we're seeing that already in Canada. There's lots of people that are focusing on just the medical side, right?
Go ahead.
Tom Sipos, a question about, some people talk about the fact that when the American market wakes up, it'll crush the Canadian market in terms of our lead and our position in the world. But when you look at some industries like the mining industry, where there is no regulatory advantage in the States or Canada, Canada still seems to lead in terms of mining finance for the whole world, despite the fact there's no arbitrary barrier. I wanted to ask your comments about what do you think is going to happen when the U.S. wakes up and allows cannabis? What will that do to Canada's leading financing, research, and all of these things?
Can I like lead us all in a group exercise here? We are as good as Americans. Let's all say it together. There is no reason to believe that there's some sleeping giant out there that's going to crush us. Like, when's the last time you were in an adversarial situation with somebody, and the move was to make them feel like they were better than you? Like, we all need to collectively think as an industry that we are going to dominate. Like, we are the ones that are going to do this. This is a Canadian thing. This is not an American thing. They've got access to capital. We have access to capital. They have access to talent. We have access to talent. We are in the lead right now. Let's keep it up.
But there's 360 million of them.
Great. I'll sell our product to all of them.
Listen, I'm all for the little guy, and I love when, Samson and Goliath.
We're not the little guy. This is all coming from a place of, anyway.
But in terms of numbers, we are. And when it comes to business and capital markets, we can never be the New York Stock Exchange. My point is, we've developed a
The
niche
TSX is much bigger than the New York Stock Exchange when it
we're on
comes
the
to
New York
mining.
Stock Exchange.
That's my point, is can we maintain that lead? Can we, the little guy, just as good as the American, but the little guy, maintain that lead that we have in cannabis once the U.S. wakes up?
If I can tackle that a little bit differently, I think what we've seen, and I think we highlighted this at the beginning of the panel, was we've done a really good job, and it's taken us 6 years to get to where we are from a regulatory perspective. You look at the regulations, I mean, that has been the single largest advantage that any licensed producer today has in the international scale. The reason we're exporting to Germany is because we've not only got GMP, we've got a quality control testing mechanism in place. We've got a pesticide regime in place. There is no other country today that has that level of sophistication in terms of the regulations. That is the single thing that's keeping us in the international market. And that will continue to dominate on that side. We've looked at UN treaty issues, we've looked at cross-border issues, we've looked at not flying over areas where cannabis is legal. I mean, this is going to take the Americans a significant time period to develop that sort of a robust regulatory regime. I think that's going to probably keep us in the game for a long time. That's really given us the lead so far.
Yeah, and I think the U.S. is a very large consumer market, but in terms of, from my experience, the sophistication of large enterprises, it's very difficult to get close to any of the Canadian companies, like the sizable ones. And if you look at other industries like, Pfizer, Bayer, those aren't American companies. Those are companies that built real proprietary value around product development, pharma product development. They're German, they're Swiss, they dominate the US. So I think it's, I think that's, it's like a self-defeating attitude to have, and you got to focus on what you're doing. And right now we have a very good situation in the world, and I think Canadian companies can add value far more than most American companies, just primarily driven because of capital markets and regulatory environment. Going into any international market, I would say we're far more welcome going into those international markets because we're operating in a federal regime. So I think, rather than thinking about that, it's put your head down, keep going, because right now, we're ahead.
I think we're lucky as well, and I think it's things like Jordan, right, talking about, like we are the guy, like we're the leaders, and I think we've been fortunate that the LPs have not rested on their laurels, that they're not just relying on first mover advantage. They're being active. They're putting bricks and mortars down in other countries, right? And when we do those sorts of things, that continues to have that lead. Like, US is obviously a huge market. Germany's a huge market. England's a huge market. At some point, all these countries will either have medical or rec legal. It's going to take a long time for them to get there. And I think as long as Canadian companies sort of keep moving the goalpost forward, it'll make it harder and harder for them to catch up. And mining's a great example, and hockey's a great example. Like, Iceland's got a great soccer team. It makes no sense. They have 300,000 people there. I live in Mississauga. Mississauga's population is better, right? If you work hard and you do a good job, there are ways to keep that lead going, right? And I think we've been fortunate, and there's a lot of things that the LPs I think might have messed up, but I'll give them full credit for being aggressive and doing a good job of actually executing their international plan. So I think we'll be leaders for a long, long time. And it'll be like, I view it as like it's gonna be like mining, right? There's a mine in Chile. Somehow, some way, there's a Canadian nexus, almost always. And I think cannabis will be like that for us as well.
Jordan is one of the reasons why Canopy has a $7 billion valuation.
You'll be bullish, man. You got to be bullish.
Anyone else? Yes, go ahead.
Hi there. Great presentation. You used the term seed to sale, and I know that the Senate of Canada has recommended the federal government implement a seed to sale method of tracking product. Is that a realistic expectation? Do you think that the federal government will implement a way of tracking product like that?
Yeah, so a couple of things. First of all of the licensed producers today are using seed-to-sale tracking software to be able to carry out their operations as well as to comply with Health Canada reporting obligations. Before the Senate recommendation, actually the task force and the federal government put in their consultation paper that they're putting together a cannabis tracking system called the CTS. And so that's very much happening. Health Canada has started working internally on a reporting feature that we will see live very soon. There's going to be a tracker for licenses and all of those things, but we're very much moving in that direction. If your question is, will we see one seed-to-sale company? I think that's where it's going to be a little bit more challenging from a federal basis.
Thank you. Thank you very much.
Yes, go ahead.
Hi, I'm more interested to know about the environmental side of the companies. Considering agriculture is one of the largest polluters, how can or is cannabis different, and what can the new and emerging industry players learn from the existing?
So our crop is a little different than most agricultural crops because you end up smoking a lot of it. So the things that you can put on it is very limited by comparison. So when you think about effluent or pesticide runoff that you would get from a traditional farm, it doesn't really exist in a cannabis greenhouse because the pest management systems that you're using are much different. So we have a little bit of this problem, but not nearly as much as normal agriculture. And because outdoor growth is just become law in the last couple of days, but up until now it's been greenhouse. Those systems are quite green. So when we transitioned a big greenhouse in BC from pepper production over to cannabis production, it was about 1/80th the amount of water to be able to produce cannabis versus peppers. And if we compared that to a field operation, it would be 1/240th the amount of water that would be used from that footprint had we had gone with a field grow versus a cannabis crop. So it's a pretty resilient and a fast growing crop, and for us that's not really, I wouldn't say that's a huge top of mind concern for our industry. It's fairly green.
If I could just add to that, I mean, there are companies like Fantino Labs in Maple Ridge, BC, that are doing a lot of work on sustainable agriculture and specific to cannabis. I mean, the whole initiative and the whole model for Fantino Labs is sun-grown. I mean, they want to be environmentally sustainable. They want to make sure that they've got not just low cost of production, but they're also sort of raising that standard in terms of an environmentally sustainable business. And more LPs are starting to look at that.
Yeah, Deepak, I think we've seen some LPs using solar power as well, right? I mean, it's not maybe not their primary source, but they're trying to be creative at least, which is nice to see.
Yeah, I would say power is more of the impact. Versus agriculture, you use a lot more power, commercial power. So I think that's, as Ranj mentioned, that's definitely an area to focus to be more sustainable, use more renewable power.
Hi, fellow Everett. I was just curious, we spoke a little bit, and I'm going to rebut that comment as well for any of you that are old enough to remember the Avro Arrow, fastest supersonic fighter jet in the world. That was a Canadian invention that the Americans made us cut up, and I'm not going to forget that. And that's not going to happen this time, I'm sure of that. Anyways, it was more on education, so we see New Brunswick taking, I think, quite a big lead there in education. Maybe some comments from the group on what they're doing to really push education on a similar topic. I think that is one area where we can excel definitely from our neighbors in the U.S. And what do you guys have as recommendations, both maybe internally and also perhaps for the institutions that are out there?
Yeah, absolutely. I mean, I remember 4 years ago or 3 years ago recruiting Jordan when I wrote the first university level course for cannabis in Canada, and we're like, let's get this mainstream. And Jordan was kind enough at the time; he got lots going on, but committed to teaching. I think it was two sessions of this course that ran 3 months long, and we've had a lot of commitment on behalf of industry towards education. In fact, at Cannabis Compliance, we've got our own training modules in place where we're looking at industry experts in their various fields, whether it be cultivation, whether it be post-harvest processing, whether it be marketing or finance, and we're developing this center of excellence. And New Brunswick is a great example of a province that said, hey, here's a gap as an industry. We're very economically deprived. We're going to dedicate resources towards this. And now we're seeing that happen across not just licensed producers, but also universities and companies coming to the space.
On the education piece, I think that's a very, very important aspect of this whole industry, dealing with the stigma, the associated negativity that's around, and of course that people play on who are not informed, educated, or aware. So I think part of this moving forward strategy, which the government has undertaken to do, and I think in a very responsible way, as opposite what's happening in the United States with the various levels of government basically duking it out, and the disparity of what you can and can't do in this particular industry, we're quantum leap ahead. But education can't be forgotten in all of this, because the thing that is, I think, one of the major challenges yet to be overcome is not so much the legalization, but also the stigma associated with this particular item. And I'm speaking about that mainly from the point of view of how that detracts from the benefits that are accrued from the medical side of the plant.
Yeah, I think on the, sorry, go ahead, Jordan.
No, go ahead.
So, I mean, it's a big opportunity. It really, you look at the stakeholder level for us. So every time either a new country or a new sort of market opens up, you think about who needs education in that space, and then get them up to speed as fast as possible. It's almost like education is a great biz dev tool for us. So when we went out to start entering into all the provincial tenders, we layered on modules of education for the retail staff to say, we've got 100 people that work in our call center. We've gotten good at customer service. Here are the 50 questions that you're most likely to get, and here are some good ways to have rebuttals to those, or to be able to navigate people through that system. That's just on retail. So we have active doctor education programs, pharmacist education programs. We actually did a bunch of police education programs in the early days, because patients were worried about cops not knowing the difference between medical and illicit cannabis. So we did about 4,000 officers that ran through this little module through the college. I feel bad that I don't know the exact name. You're going to crucify me for not knowing.
I missed the course.
Yeah. But just getting every stakeholder up to speed it's really incumbent on industry to get there, and you can build industry a lot faster when you do it.
I think getting healthcare practitioners educated is going to be a key part of this whole thing, right? Like, we do things where we try and educate. We teach a course at Western University, and that's great, and that's good and fine. And we're working with colleges to create more cultivators, and that's good and fine. But at the end of the day, you need to educate the end user as well. And I think one way to do that is to get the doctors comfortable with prescribing and sort of leading people towards it. And that helps to destigmatize too. If you go to your doctor and your doctor says, hey, this is an alternative, not push it, but here's an alternative possibly that may work for you. That would be a key part of the education, is making sure the doctors are up to speed and the various colleges.
And we're already seeing that happen. I mean,
Yeah.
McGill's got a program, Niagara College has got something going, Loyalist has something. So they're all being mainstream here.
Helpful?
There's a question for that.
Yes, go ahead.
So we talked about Canadian advantage before, but I think that discussion was more about the product itself. I'm wondering if you have any comments about the ancillary market and how to have a Canadian advantage there. Because there's a lot of companies coming out of Colorado or California with their grow boxes, other accessories and things, and I think that's where there is a disadvantage in Canada now.
Yeah, so on the ancillary side, I guess it's up to me because I mentioned ancillary first. I think it goes, you're right, there's in places like California, there's lots of products and distribution is different down there. I think it goes down to, the way I view this business is the way I view any business, which is it's about execution, right? And so if you're good at what you do, it doesn't matter where you are, you'll excel, right? I think what we are seeing a little bit is that we're seeing a little bit of piggybacking off places like the US, where you'll see US companies coming to Canada and doing a joint venture or a licensing agreement, and then Canadian companies are able to use that technology or that knowledge to their advantage internationally. So I've worked on a few of those where we do a licensing agreement with a US company and you get global rights to go outside and work with, international companies. But again, I think it goes down to execution, right? Like, ancillary companies are no different than cultivators, which are no different than a beer company, that's no different than a widget company. You need to have a model, a business plan, and you need to execute it really well, right? I think that's really the answer, is just good execution.
A final question to our panel, just before we wrap it up. Biggest challenges facing Canada, whether it's domestic or on a global scale, as we go into this next phase?
Clearly we're going to have challenges with taxation. I think that from a consumer perspective, medical cannabis is being proposed to be taxed by the federal government, which in my opinion is a huge challenge, because if medical patients are not able to afford medical cannabis, that's a significant problem, and it's something that I'm working on. I'm part of an organization called CFAM, which is Canadians for Fair Access to Medical Cannabis, and we're lobbying for that change. But I think that affordability on the medical side is probably going to be one of the challenges.
No.
It's the hot topic right now, legalization. I think the biggest challenge, that's going to be, out of the gates, that's a very large market. We have a very large existing market with the black market, and this for the most part it's quite sophisticated, product quality, etc. So I think the biggest challenge is the legal industry going to be able to produce a product that meets subjective quality aspects? I think all producers, being in such a regulated environment, all meet objective quality or of all high objective quality. But are they going to be able to? Are we as an industry going to be able to produce a product that the consumer wants? Because at the end of the day, that's what makes the decisions. That's who's going to decide winners. Is are we able to provide Canadian consumers, cannabis enthusiasts, whatever you want to call it, legal age consumers, a product that they're used to getting from the black market? I think we have a great system to do that, but I think early on that will be a big challenge to determine if legalization is working.
Ranj.
I'm going to piggyback off Deepak. There's lots of good answers, I think, no wrong ones. I'm going to piggyback off Deepak on this one. We do pro bono work for CFAM as well, and I think in this whole mix of recreational being the sexy topic, people are not paying enough attention to what actually got us here, which are people that needed the product for medical reasons, and the taxation, the education, branding side, and access generally on the medical side is something that I think we really need to make sure that we continue to push. And I think actually, as Canadians and as market leaders, it's part of our Canadian story that as we talk about internationalization, that we actually talk about the medical side and all the good that can do.
Julian.
Well, Canada has done a relatively good job looking at all the what-ifs and risk managing the whole explosion of this area, if you will, and that's to the credit of policymakers. However, there's just absolutely no way, I believe, that organized crime will not put its fingerprints on this. So I think keeping the industry clean going forward will be a huge issue. And I think that keeping organized crime at bay will be a very significant challenge. And I say that from past experience about how organized crime operates, especially the moment you start taxing things and the moment that you have opportunities for people to evade due process, you can count on it.
Jordan, final word to you.
On the Canadian recreational side, it'll go in waves, right? So the first wave of challenge that we'll have is just capacity, just getting products on the shelf. Operating at this scale is a huge challenge, and none of us have done it before, even the biggest ones. So that'll be a challenge, and we'll have to work through that. Then the market will shift to quality, so consumers will get a sense of what's good, what they like, what they don't, and there'll be a lot of attrition in the industry based on that. Just because you can get it on the shelf is one thing, but you got to get something really great on the shelf. And then we'll start to feel the price pressure in the third wave, and that'll lead to more attrition, and that'll lead to a much different market dynamic. So we got to find ways to navigate all of those challenges to be able to come out on top. And then it's kind of the last one is it's just exhausting. Like it's hard to sprint a whole marathon. We've been doing it a long time, and there's still a lot of work to be done. So just general attrition. I think people got to stay sharp, stay fast.
Okay, well, I want to thank all of you for joining us this morning. Deepak, Nav, Ranj, Julian, Jordan, thank you for your perspective. Thank you to all of you for joining us. And of course, we're going to continue the conversation on the growthop.com. Thank you very much.